My name is Geneva M. Alcantara and I'll be sharing to you the trivia or facts about integumentary system. 1. The skin is considered as the largest organ of the body. It makes up the 15% of the total body weight of a human being. 2. The average person's skin covers an area of 2 square meters. The average adult has approximately 21 square feet of skin, which weighs 9 pounds or 4.1 kilograms and contains more than 11 miles or 17.7 kilometers of blood vessels. 3. The average person has about 300 million skin cells. A single square inch of skin has about 19 million cells and up to 300 sweat glands. 4. We have a lot of skin cells, so we lose about 30,000 to 40,000 dead skin cells every minute. That is approximately 50 million dead skin cells every day. 5. Skin renews itself every 28 days. It regenerates by shedding off old dead skin cells and replaced with new ones. It is faster when we are younger and slower when we get older. 6. The thickest skin is on the palms and soles of the feet, and the thinnest is on the eyelids. For palm and feet can be 3 millimeters, and for the eyelids is 0.5 millimeters. 7. Skin can form additional thickness and toughness. If it is exposed to friction or pressure, it became callous like this. Deficiency of oxygen in the skin leads to the bluish appearance of the skin. So the skin became blue and the process is called cyanosis. Number 9. The nails are an extension of skin. The nails originate from epithelial cells from a nail root. The skin cells grow over the epidermis layers of the skin. The cells are a keratin substance that is similar to the top layer of the epidermis. 10. Some of the nerves in the skin is connected to muscles. So this will be connected to number 15. Wait. So 11. The UV radiation can damage the skin. Too much exposure to sunlight, UV radiation can increase the skin cancer skin cancer. But 12, the skin produces vitamin D. The skin on exposure to sunlight initiates the process of producing vitamin D for our body. Then 13, skin can heal itself. There is 3. The primary intention, secondary intention, and regeneration. Primary intention, the wound closes when the edges are pulled together. Wound heals quicker and there is less scar tissue. The secondary intention, wound that is left open regenerates. Scar tissue will develop when wounds are large, and this type of wounds takes longer to heal. Regeneration occurs when the skin is damaged, affecting the blood vessels. The scab, protective tissue, forms as a protection from anything that may enter the wound, such as pathogens. And 14, the skin has no hair is called glabrous skin. So the thickest skin, the palm and the feet, are glabrous skin. These are the skin that became crinkled when we spend too much in the swimming pool, or even when you take a bath for a long time, it becomes crinkled. That's glabrous skin. Then 15, connected to number 10, goosebumps are caused by the contraction of small muscles called arrector pili. Yes. The goosebumps is not because of the skin, but it is because the small muscles are connected to our skin. Then the last one is 16. Having a large amount of vitamin A supplements can turn your skin yellow or even orange. or you intake large amount of vitamin A, your skin will be affected and become yellow or orange. Well, that's all for the trivia. Thank you!
Good morning, everyone. I am Christine Alison Arugas from 1A BSRT, and we're going to report about the integumentary system. So first, what is integumentary system? So integumentary system comprises the skin and its appendages, acting to protect the body from various kinds of damages, such as loss of water or damage from outside. The integumentary system includes hair, scales, feathers, hooves, and nails. The body is covered with skin, nails, and hair. Together with glands found in the skin, they make up the integumentary system. It gets named from the Latin word integumentum, meaning covering. In humans, the primary organ of the integumentary system is the skin. The skin is an organ just like the heart and lungs. It is the largest organ in the body. The skin has two layers. One is the epidermis, which is the outermost layer of the skin. Epidermis contains cells that produce pigment and protect immune system. And it also helps prevent harmful substances from entering the body. The second one is the dermis. It is the innermost layer of the skin. Dermis contains nerve endings, oil and sweat glands, and hair follicles. And it also helps prevent harmful substances from entering the body. Another layer of the skin is the subcutaneous tissue or subcutaneous fascia, which made up of fat, connective tissue, and larger blood vessels. Subcutaneous tissue is the deepest and innermost layer of the three layers of skin. It's mostly made up of fat, connective tissue, and larger blood vessels and nerves.
Good day everyone, I'm Ira and I'm going to discuss the accessory structures of integumentary system, which composed of glands, hair, and nails. In glands, we have sebaceous, sweat, and ceruminous, while in nails, it includes lunula, nail bed, and epinecium. Without further ado, let's start. First accessory structures that we have is the glands. There are glands in the dermis that secrete substances necessary for skin function. First is the sebaceous glands secrete oil called sebum. It keeps the hair and the skin soft and pliable or flexible. Next we have in the list is the sweat glands. Help regulate temperature by secreting sweat onto the surface of the skin. When the sweat evaporates, the skin cools. Next is the ceruminous glands. Specialized glands in the ear named secrete cerumen, a waxy substance that helps prevent bacterial infection. Next in the list, we have here hair follicles. There are also hair follicles in the dermis. They grow the hairs that covers our skin in certain places. When hair is lost on top of the head, the person is said to be bald, and the medical term for bald is alopecia. The opposite of the presence of excessive body and facial hair, especially in women, is called hirsutism. Last but not the least, accessory structures that we have is the nails. Nails are protective coverings at the ends of our fingers and toes. Nails are epithelial cells that have been hardened. First anatomical structure is the lunula. At the base of each nail is the white half-moon-shaped lunula. The word lunula means moon. It is from the lunula that the nail grows. Other anatomical structures are the nail bed and the cuticle or epinecium. That's all for my report. Thank you for listening.
Good day, I'm Frances Angela Eslimpanog and I am about to discuss the function of the skin. So, let's begin. The function of the skin. First, it is to protect. Second, sensation. Third, regulation of the body composition. Fourth, respiration. And fifth, absorption. So let's go back to the protection. Protection is the primary function of the skin. All layers participate in providing protection against the affection of ultraviolet rays, mechanical injury, and invasive pathogenic microorganisms. So, it protects the skin. It is the primary function of the skin. And then the next, sensation, is performed by various nerve endings found in the skin. Then the third, regulation of the body composition. Heat is regulated by skin through vascular responses and by sweat secretion. So later on, we'll discuss about the sweat secretion. And then next, the respiration. Fourth, the respiration. The skin performs a respiratory function but is relatively significant. The skin gives off of only 1 to 220 as much as carbon dioxide. The lungs and absorb only 1 out of 135 as much as oxygen. So next, fifth is absorption. Most of the substances through the skin occurs only to a slight extent, but probably takes largely through the appendix. Integumentary system. This system forms covering of the body. The organs are skin, nails, and hair. The skin is the largest organ of the human body in terms of covered area. It covers and protects the human organ and those body of those animals. It is responsible for many of body reactions to the environment. It is also an organ of excretion and secretes sweats. The skin has many different functions, but its most important function is protection. The integumentary serve as a barrier against infection and injury. It helps us to regulate body temperature, removes waste products from the body, and provides protection against ultraviolet radiation from the sun. Because the largest component of integumentary system is the skin, contains several types of sensory receptor. It serves as the gateway through which sensations such as pressure, heat, cold, pain are transmitted to the nervous system. The skin has the outer layer called epidermis and the inner layer called dermis. What's the function of the epidermis and dermis? Epidermis comes from the Greek word epi meaning on the outside and derma meaning skin. Epidermis, the outer layer of the skin, has two layers. The outside of the epidermis, the part that comes in contact with the environment, is made up of dead cells, and the inner layer of the epidermis is made up of living cells. In the inner layer of the epidermis undergo rapid cell division, producing new cells that push an older cells to the surface of the skin, and as they move forward and upward, the older cells become flattened and the organelles disintegrate. Also the beginning of making keratin, a tough and fibrous protein. Eventually, the keratin-producing cells die and form a tough, flexible, waterproof covering on the surface of the skin. This outer layer of dead skin is shed or washed away in surprising rate once every 4 to 5 weeks. the epidermis also contains melanocytes. Melanocytes are the cells that that produce melanin, a dark brown pigment. Also, most of the people have roughly the same number of melanocytes in their skin. Difference in color are caused by different amount of melanin the melanocytes produce and where the cells are distributed. The inner layer of the skin is dermis. It lies beneath the epidermis and contains collagen, fibers, blood vessels, nerve endings, glands, sense organ, smooth muscles, and hair follicles. When the body needs to conserve heat on cold days, the blood vessels in the dermis narrow. Helping to limit heat loss on hot days naman, the blood vessels widen, bringing heat from the body's core to the skin and increasing the heat loss. The dermis contains two major types of glands, sweat glands and sebaceous or oil glands. These glands have an opening in the epidermis at the surface of the skin through which they release their products. If your body gets too hot, sweat glands produce perspiration or sweat. When sweat evaporates, it takes heat away from your body. Perspiration contains water, salt, and other compounds. The release of this secretion is stimulated by nerves impulses when the heat temperature of the body rises above normal average. Sebaceous glands produce an oily secretion called sebum that spreads out along the surface of the skin that helps to keep keratin rich, flexible, and waterproof.
Related abbreviations and acronyms in integumentary system. It improves communication, understanding between health practitioners, leading to safer and more effective care for patients. First, we have capital BCC or basal cell carcinoma is a malignant tumor of the epidermis. Unlike other malignant skin cancers, it rarely spreads to other locations. Capital SCC or squamous cell carcinoma is also a malignant tumor of the epidermis. It has a tendency to spread to other organs. Capital B, lowercase x, BX or biopsy, a procedure involving the removal of a piece of living tissue which is then examined for any abnormalities. Derm or dermatology, the area that studies integumentary, wherein a dermatologist is a doctor that specializes in treating skin, hair, nail, and mucous membrane disorders and diseases. Triple capital A, apply the affected area. Capital SLE or systemic lupus erythematosus is an autoimmune disease in which the immune system attacks its own tissues, causing widespread inflammation and tissue damage in the affected organs. Capital UVR or ultraviolet radiation. Exposure to UV radiation can cause our skin to tan and even burn. Capital MM or malignant melanoma is a type of skin cancer that develops from the pigment-producing cells known as melanocytes. Capital FH or family history. A family medical history can identify people with a higher than usual chance of having common disorders such as heart disease, high blood pressure, stroke, certain cancers, and diabetes. These complex disorders are influenced by a combination of genetic factors, environmental conditions, and lifestyle choices. UNG or ointment. A smooth, oily preparation that is rubbed on the skin for medicinal purposes or as a cosmetic. Capital P or physical examination. A physical examination is a routine test to check your overall health. The exam is also known as a wellness check done by a primary care provider. That's all for my presentation. Thank you for listening and stay safe. For references, thank you.
on to medical terminologies in integumentary system. Antipyretic, drug used to relieve itching. The prefix anti means against, root word purite means itch, and suffix ic means pertaining to. So it is a medication against itching. Dermatophytosis. Root word dermatophyte means fungal of skin, suffix osis means condition or disease, so it is a fungal infection of the skin. Erythroderma, an intense and usually widespread reddening of skin. Prefix eryther means red with combining vowel O, and root word derma means skin, so it is the redness of the skin. Folliculitis, an infection in the hair follicles. Root word folliculus means small cavity or follicles, and suffix itis means inflammation, so it's an infection in the follicles. Hydrosis, the production and excretion of sweat. Root word and combining vowel hydro means sweat, and suffix osis means condition, so it is a disorder condition of excessive sweat. Lipoma, an uncancerous growth of fatty tissue cells. Root word lip with combining vowel O means fat or fatty tissues, and suffix ma, which means the result of. So therefore, it is the result of fatty tissues. Melanosis, disorders of increased melanin pigmentation that develop without preceding inflammatory disease. Root word and combining vowel melano means black, and suffix osis means condition, so it is black pigment of the skin. Neurodermatitis, an extremely variable eczematous skin disease that is presumed to be a response to prolonged vigorous scratching, rubbing, or pinching to relieve intense pruritus. Prefix neuro means nerves, and root word derma meaning skin, and suffix itis means inflammation. Onycholysis, root word onych with combining vowel O means nail, and suffix lysis means separation, so it means the loosening or separation of a nail from its bed. Pachyderma, prefix pachy means thick, and root word derma means skin, so it is an abnormal thickening of skin. Psoriasis, a skin disease that causes itchy patches of thick red skin with silvery scales on the scalp and flexor joint surfaces. Root word sore meaning itch, and suffix iasis means abnormal condition, so it is an abnormal condition of itchy skin. Scleroderma, an autoimmune chronic disease that affects the body by hardening connective tissue. Prefix scleros meaning hard, and root word derma means skin, so it is the hardening of the skin. Scleroderma, an inherited condition characterized by an extreme sensitivity to ultraviolet rays from sunlight. Prefix zero means dry, and root word derma means skin, so it is the dryness of the skin. That's all. Thank you.
Here are some examples of medical terms. One is the carcinoma, means cancer. Oma means tumor. Carcinoma means malignant tumor. A carcinoma is a malignant neoplasm composed of epithelial cells that invade surrounding tissue and metastasize to different areas of the body. Another medical term is the cellulitis. Cellular means consisting of cells. Itis means inflammation. Cellulitis is a bacterial infection of the skin that is localized and characterized by heat, swelling, pain, and other signs of inflammation. Next, dermatology. Logy means the study of, and dermatology means a division of medicine that diagnoses and treats conditions of the skin, hair, and nails. Next, dermatologist. Dermo means skin, And logist means one who studies of the skin. Dermatologist is a physician specializing in the treatment of the skin and accessory structures. Next is the dermatitis. Dermato means skin and itis means inflammation. Dermatitis means inflammation of the skin. Next is the dermatoconiosis. Dermat or derma means skin and coniosis means a disease state caused by inhalation of dust. Osis means condition or disease. Dermatoconiosis is a abnormal condition of the skin caused by dust. Next is the dermis, meaning skin. Dermis is the layer of the skin directly below the epidermis. This layer contains blood vessels or capillaries, nerve endings, sebaceous glands, hair follicles, elastic fibers, collagenous fibers, involuntary muscles, lymph vessels, and sweat glands. Next is the epidermis. Epi means on or upon. The dermis layer does not have blood vessels and does not contain nerve endings. Next is the keratosis or actinic. Actinic means ray or radiation. Keratosis is an area of the skin that is overgrown or thickened. Actinic keratosis is thickening of the outer layer of the skin caused by prolonged exposure to sunlight. Next is the subcutaneous fascia. Sub means below or beneath. Cut means skin. Cutaneous means pertaining to the skin. Subcutaneous means beneath the skin. Fascia is a fibrous connective membrane. The subcutaneous fascia is a bottom layer of the skin. This layer is composed of connective and fatty tissues. Next is hematoma. Hemato means blood or blood vessel. Oma means tumor. A hematoma is a collection of blood that is trapped in the skin tissue that is a result of trauma. Next is melanin. Melan means black and melanin means a black pigment in the skin. Melanoma. Melano pertains to melanocytes. Oma means tumor and melanoma means a malignant neoplasm of the skin that is composed of melanocytes. That will be all. Thank you.
So here are my 13 medical terminologies I've chosen in related to integumentary system. First is the term candidiasis. A candidiasis is a fungal infection caused by a yeast or type of fungus called candida. Next term we have cicatrix. Cicatrix is the medical term for scar. Next term we have diaphoresis. Diaphro or diaphro means profuse sweating, while the suffix cis is pertaining to a condition. Diaphoresis is excessive sweating due to an unrelated medical condition or medication side effect. Next term we have a plastic surgery. Plastic surgery is a branch of medicine that treats the conditions of the integumentary system, wherein a plastic surgeon is a physician that repairs, improves, and reconstructs damaged body structures. Next term we have cryosurgery. Cryo means cold. A cryosurgery is a surgery that uses sub-freezing temperature to destroy tissue. This procedure can be used to treat cancer or lesion of the skin. Next term we have cyanosis, wherein cyan means blue and the suffix cis means condition. Cyanosis is the bluish discoloration of the skin. Next term, we have electrodesiccation. Electro means electricity, desiccare means to dry up, and the suffix ion, ion, means process. Electrodesiccation is a technique which destroys tissue by burning it with an electric spark. Next, we have ritidoplasty. Ritidoplasty, ritid means wrinkle or ritid means wrinkle. Meanwhile, plasty means surgical repair. A surgery in which the skin of the face is tightened and wrinkles and other signs of aging of the skin are eliminated, also known as facelift. Next term, we have liposuction, wherein a lipo means fat or adipose, and suction means to draw or aspirate a liquid or semi-liquid. Liposuction is the removal of adipose tissue with the use of suction device. Next term, we have a phototherapy. A phototherapy means a photo means light and therapy means treatment of any disease. In words, phototherapy is the treatment of a disorder using light. Phototherapy can be used to treat skin conditions. Next, we have skin graft. A skin graft is when a portion of the skin is implanted to cover another area where the skin has been lost. Next term is papilloma. Papil or papilio is nipple. Papilloma is a benign nipple-like growth projecting from epithelial tissue. Examples are warts. That's all. Thank you.
Acne is a disorder sebaceous gland and hair follicles in the pimple size that are infected with abscess occur. Alopecia. Alopecia is a lack of hair due to the condition such as normal aging, skin disorder, anti-cancer medications, and endocrine disorders. Ecchymosis. Ecchymosis is an area bluish discoloration of the skin caused by the spilling of the blood into the subcutaneous tissue caused by some type of trauma to the area. Ecchymosis is also known as a bruise. Erythema. Erythem means red. Erythema is a reddish color to the skin. This occurs when there is a rush of blood to the surface of the skin. Erythema is usually associated with fever or some type of socialized inflammation. Eczema is a condition that makes your skin red and itchy. The subsequent rashes can develop in response to certain allergies including pollen, pet dander, and foods. Erysipelas. Erysipelas is an infection of upper layers of the skin superficial. The most cause of this group is an streptococcal. Pemphigus vulgaris is a rare autoimmune disease that causes painful blistering on the skin mucous membrane. The most common type of group of autoimmune disorder are called pemphigus. Next is petechiae. Petechiae is a tiny red or purple spot that on the skin and that are due to numerous tiny hemorrhage in the dermal layer. Purpura. Purpura means purple. Purpura is a bleeding disorder that is due to hemorrhage into the tissue of the skin which causes ecchymosis and petechia. Urticaria. Urticaria is a skin eruption that has a wheels of various shapes that have red margins and a pale center. Vitiligo. Vitiligo is a skin disease of unknown cause that is benign and characterized by irregular patches of skin that lack pigment. Xanthelasma are yellowish patches that tends to occur on the eyelid. They are the result of deposited cholesterol.